Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Pathology of hydronephrosis. So hydronephrosis occurs due to the following things. So what is happening? So whenever there is obstruction anywhere in the path of the urine flow, then this will result in, first there is dilatation of calyceal system will occur. Slowly this dilatation of calyceal system will expand, okay, and this will compress the normal renal parenchyma, and due to the pressure atrophy, because this dilated calyceal system is putting pressure over the renal parenchyma, and because of that there occurs pressure atrophy in the renal parenchyma, resulting in destruction of renal parenchyma. Slowly and slowly this renal parenchyma becomes only a thin walled structure, because the renal parenchyma becomes atrophied, resulting in thin walled structure with a sac completely filled with fluid. So this is called as hydronephrosis. So whenever that is the thing that occurs, so first there is calyceal dilatation is seen, and because of calyceal dilatation there is pressure atrophy. First there is calyceal dilatation, and there is pressure is applied on the renal parenchyma. So because of the pressure on the renal parenchyma, this has resulted in pressure atrophy of the renal parenchyma. Thus, the renal parenchyma is destroyed. So, when there is pressure atrophy of the renal parenchyma, now the kidney is seen as a thin walled, lobulated, fluid filled sac. So, this is the main thing that occurs. Then, there is also urethral obstruction is also seen. Whenever there is urethral obstruction, see, if this is the urinary bladder, there can be urethral obstruction is seen. Whenever there is urethral obstruction, this will result in hypertrophy of the detrusor muscle, okay, and this hypertrophy of detrusor muscle will lead to obstruction of the ureters also in their intramural course. So first, there is urethral obstruction. Urethral obstruction has resulted in detrusor hypertrophy. This detrusor hypertrophy has caused obstruction of the ureter. Okay, so this is the second course, second pathogenesis which is seen. Urethral obstruction, detrusor hypertrophy leading to obstruction of ureters.
thank you and thank you for watching.